My name is Annika Carter and I'm representing Team 68. We are developing an anti-infective intraocular needle. My team consists of myself, Nick Rajali, Arjit Kaur, and Jeremy Hammer. We are all students of the Department of Bioengineering at the University of Utah. Now, intraocular injections are the standard form of treatment for many retinal diseases. These procedures are performed by retinal specialists in a clinical setting. Now, the largest risk of this kind of procedure is infection. When you insert a needle into the eye, bacteria from the surface of the eye, also known as the conjunctiva, enters the lumen of the needle. Upon injection of the drug, this bacteria enters the intraocular space where it can proliferate and cause loss of vision. Now, our solution to this problem is to cover the lumen of the needle, to insert the needle into the eye, remove that cover, and then inject the drug. Just last year, 3 million injections were performed. Of those 3 million, 5,000 infections resulted. This cost the hospital $60 million. As you can see from this graph, since 2003, there has been rapid growth in market size. This is about 25% a year. If you look at market segmentation, BD covers about 70% of the market size. The other 30% is covered by other small medical device companies. If you look at competitive products in the market, you can see that really there's just our device and the standard hypodermic needle. Our device has all the features of the standard hypodermic needle, but adds the property of being anti-infective. Now, in this video, I'll show you the different features that add this feature of being anti-infective. The first element is the biodegradable membrane that is attached to the tip of the needle. It is made of a material that is FDA approved in the intraocular space. Next is a stainless steel rod that punctures through the membrane, creating a path for drug flow upon injection. We've also modified the hub to have two different ports. The first has a rubber septum on it to create a closed system upon removal of the stylet. The second is for syringe attachment. When you take all of these features and put them together, you get a device that is anti-infective. It not only has this feature of being anti-infective, but it's also easily integrated into the market. It only requires 510(k) clearance for FDA approval. It also only costs 10 cents to manufacture. It's easily integrated into this manufacturing process and is also compatible with current sterilization and clinical techniques. Lastly, for proof of concepts, we have finished preliminary testing to show that the membrane can adhere to the tip and be punctured with the rod. We are also moving on to preclinical trials with the Moran Eye Center. Finally, I'd like to leave you with our vision. Our main goal is to increase patient health and safety by reducing infection. Second, our goal is to decrease the cost due to infection to hospitals while also increasing profit for our investors. And finally, we would like to integrate our device into vertical markets. Thank you for your consideration. Team 68.